Hello, Dr. Jessica here with ProActive Physical Therapy and Wellness. And today I wanted to talk to you a little bit more about our women's health program and all of the things we can offer. And so we'll start with urinary incontinence. So if you experience any leaking, so if you have to, you're thinking, oh goodness, I'm in some place I don't know, where's the nearest bathroom? Or if you're afraid to cough or sneeze, or play with your kids, or pick up your grandkids because you think you're gonna leak. Or maybe you bring an extra pair of clothes with you just in case. Well, actually, we would be able to help you with that and figure out what the root cause of the leaking is versus just saying, oh, just do some Kegels and you'll be fine. Or just strengthen your core. It must be weak. No, we want to really individualize this to each person and dive into what makes you individual and the possible causes and things like that. So then we can also help if somebody has an issue with a prolapse. So this can be one of those individual causes of leaking. So maybe you had a hysterectomy and now you've been leaking, or you recently had a baby and you notice you're leaking, or you feel like there's something, a bulge, or you're sitting on something or something's falling out. We can take a look, an assessment, and figure out if you do have a prolapse, what the cause of it could be, and we can work on strengthening those muscles to give you a little bit more support. Or you just had a baby. That in itself, that's a big thing. Your body goes through a lot of changes, and typically we're really good at telling people to go to physical therapy after you have shoulder surgery or a knee replacement, but we're not really good to tell people after you give birth. And then a lot of changes happen before you give birth as well as afterwards. And so with that, you can have some low back pain, some hip pain. You may have the prolapse like I talked about before, or you may be experiencing some pain. If you had tearing, you can have some sensitivity around that scar, and it could be hard to get back to being able to have sex in a pain-free way. And so those are some things that we can look at and assess and get you back to where you were before. And we can also work on strengthening those core muscles and get you back to working out like you were before the pregnancy. So that is a little bit about after pregnancy. Now, during pregnancy, you may also be experiencing low back pain, hip pain. Maybe you get some numbness and tingling down your legs. You could also have a little bit of that leaking. And then there's ways that we can stretch and work on the muscles to prepare to give birth. As well, if you have a C-section, those scars there, that can be very tender. And so we can work on that soft tissue and help to improve the mobility, and then work on strengthening and get you back to your regular exercise routine or start an exercise routine. And then one of the other concepts that we could work on is pelvic pain. And so this can be you're experiencing painful periods. Maybe you have pain with during sex or with a gynecologic exam. And we can work on trying to find the different causes to that pain. So maybe it's, well, you have some tenderness in your stomach, and that can be referring pain to the pelvis. Maybe you have some tightness of the muscles, and we work on some more relaxation techniques. So that is just a very, very brief snapshot into some of the conditions and things like that that we can help. And so if you have any of questions, or if you experience any of those symptoms, or maybe you're even like, well, I have this, but you didn't mention it in the video, go ahead and call us, and we'll be happy to talk with you and figure out whether it would be a good fit. Because I know it's hard when you don't know who to talk to, or maybe you've tried to talk to your doctor and they're just like, just do these Kegels, strengthen your core. Or if you're experiencing pain, oh, just drink some wine and breathe and you'll be fine. But you're not. You've been dealing with this for a while and it's not getting better, and you're going through Dr. Google, and that's just giving you more stress and anxiety. So come and have a talk with us, and I'll be happy to help, and we can work through it and see whether we're the right fit for you.